Good morning, everyone, and thank you for joining us today. I'm Victoria Wilson, a dental therapist and the founder of the Smile Revolution, an oral health promotional entity that produces content to support the dental profession's advancements and information to support the public's oral health. My work with Biomin began following a podcast recording I did with Robert Hill and Richard Watley last year. I personally use Biomin toothpaste, along with my children who use Biomin F for Kids, a new children's toothpaste. So at the end of the webinar, you can join us on the Biomin virtual stand for a live Q&A. You will have the opportunity to ask any questions you have about dentine hypersensitivity or issues raised in the session today, as well as discussing Biomin toothpaste and its unique smart technology. So now, to set the scene for today, during this dental webinar, 3 highly regarded clinical experts will explore the many challenges faced in the management of dentine hypersensitivity in a clinical setting, from diagnosis to causation, and including how to engage with patients to optimize treatment at home. One of the hardest aspects of oral health is behavioural change, and our panel will discuss connecting with patients regarding improving their diet and brushing technique. So moving on to our panelists, I have the pleasure of being accompanied by a hugely impressive group of panelists today with extensive biographies, all of which are accessible on the Biomin website event page. So firstly, Dr. David Gillam, an internationally regarded expert and author in the field of dentine hypersensitivity and a university clinical reader in periodontology and industry consultant. David began his career as a dental hygienist before training as a dentist. Secondly, Dr. Reena Wadia, who runs a specialist referral Harley Street perio practice. She lectures internationally, publishes articles regularly, and runs courses for both newly qualified dentists as well as hygienists. She was a clinical tutor at Barts and the London for 5 years and is now an associate specialist at King's College Hospital. And thirdly and finally, Siobhan Kelleher, the owner of dentalhygienist.ie, an award-winning dental hygiene practice based in Cork, and is the co-owner of Dental CPD Expert. She is also a dental business coach working with dental practices in Ireland and the UK, helping to set up dental hygiene departments and teaching essential communication skills in the dental team. She gained valuable experience over the past 20 years working in high-end specialist practices in the UK and Ireland. So now, without further ado, we begin with our first panelist, Dr. David Gillam, who will be speaking on the diagnosis and management of dentine hypersensitivity. So David, from the literature and your experience, what are the barriers in diagnosing dentine hypersensitivity?
Before I answer the question, I'm just going to briefly explain. You can see on the slide what dentine hypersensitivity is. It's a well-known clinical condition, and the underlying mechanism involved in this is the hydrodynamic theory, which promotes 2 approaches for treating the problem. You either occlude the tubules, which are open on the root surface, or you use toothpaste or mouth rinse. Basically, it's to do with fluid movement through the open dentinal tubules, which affects a response, a painful response. Now, if I go now onto the challenges that might impact on both the dentist and the patient when we experience diagnosing dental hypersensitivity, let's look at the clinician's point of view. What do they think about the problem? Well, from the literature, we find that most of the dentists seem to think that dentine hypersensitivity has a mild to moderate impact on their patients' quality of life. And also from the prevalence data, depending on whether or not we use clinical exam or questionnaires, we find that the problem may be underestimated or overestimated. But one of the problems, I think, is that what exactly is the true impact of the dentine hypersensitivity on the quality of life of patients who complain, and is it adequately diagnosed or treated? And furthermore, can dentists adequately diagnose it from other dental conditions which may have similar pain symptoms? And one of the other things which came through on the various surveys in the literature was that are clinicians really confident in successfully managing the problem in daily practice, and do they actually monitor it in daily practice? And so the problem from the clinical point of view is that clinicians do not appear to routinely screen or examine their patients for the dentine hypersensitivity unless the patient prompts them. Now, from the patient's perspective, what do they consider dentine hypersensitivity to be? Well, again, from the literature, it seems to be a mild transient pain that does not impact on the quality of life. And most patients do not even bother to treat dentine hypersensitivity. Those that do may self-treat with sensitivity or use coping mechanisms to avoid aggravating the problem. And from the literature, it appears up to 50% may not even attend or consult a dentist. Now, is that because of fear of the dentist, anxiety, fear of discomfort? Or is it due to barriers to dental treatment, cost, time, availability of appointments? But the outcome is this: patients either do not consult a dentist, they do nothing, or they self-treat. However, there's undoubtedly patients with dentine hypersensitivity who experience moderate to severe pain, which does impact on their quality of life in daily living. I hope that answers the question, Victoria.
Thank you. So what should dental clinicians of today be looking for in the materials of choice to treat dentine hypersensitivity?
Yes, this again is a very interesting question. One can approach it in two ways. The professionally applied products, such as varnishes, desensitizing polishing paste. More invasive treatment might be glass ionomer, composite materials. You can also use laser, and in some cases laser therapy, and also if they're having periodontal surgery, you may obviously use flat procedures as well. So there's a lot of innovation now with minimally invasive treatments now for toothpaste. Again, there are a number of relatively new innovations of toothpaste, but generally speaking, they are tweaks of previous systems. The stannous fluoride, strontium chloride, hydroxyapatite toothpaste, and more recently there's been development with the bioactive glasses. Some of the people listening would obviously be aware of Novamin, but also more recently there's another bioactive glass called Biomin F, a development which we were involved in at Queen Mary, and I would just briefly touch on that if I may. Other products which have been recommended but are high fluoride products. So it's not just the simple 1100 or 1450 parts per million, it's 2800, 5000. And this is generally used for protection against root caries. And what I would say is that whether you have a low fluoride of 1100 or high fluoride, when you look at the fluoride release profile, within 30 minutes, most of the fluoride is diluted down, so it doesn't protect the teeth over a longer period. And to address this issue, the development within Queen Mary was with a special glass which we call biamin, which the fluoride is contained in the glass. It's a lower level of fluoride. It releases calcium, phosphate, and fluoride ions, and it can be used for dentine hypersensitivity, but also can be used in remineralization. Now, the advantage of this from our laboratory studies is that because it's a slow release, it lasts over 12 hours, which is ideal, and it fits in with the concepts that Tenkate says of using a low level of fluoride, which is sustained over a longer period of time. And the other advantage is, to our mind, that it produces fluorapatite rather than the more soluble hydroxyapatite, which is much more acid resistant. And you can see from the micrographs that we have here, there's 3 on the screen: before treatment, after treatment, and after acid challenge. And it's quite clear that from our studies, particularly laboratory studies, that it does block the tubules, it reduces fluid flow, and in that sense it will reduce the discomfort, but also, more importantly, it will reduce the loss of tooth tissue from acid attack. So while we would say that this is a novel procedure and toothpaste, what we would say that simply giving a toothpaste without modifying and advising the patient on other factors which cause the problem in the first place would be wrong. So we'll come on to this in a moment, but I hope that's answered your question for the time being. If we go on to the next slide, please.
Thank you, David. So what would a full diagnostic test include for dentine hypersensitivity and an optimal treatment path?
Right, thank you, Victoria. Well, if we talk about the diagnostic test first, and then we'll move on to the treatment path slide afterwards. Firstly, I would say there are 2 types of patients which we broadly deal with in clinical practice. There is the patient who is new to the practice, who's never been seen, and also the patient who attends on a routine or regular basis. Now, with the first category, you don't necessarily have a prior history of medical and dental, dietary and social, so you have to spend more time on screening them for this. You then have to use code air and a probe to identify whether or not they have sensitivity. If the symptoms are unclear, you may have to spend time looking at differential diagnosis. And again, if they're a new patient, you're looking for things like caries, recurrent caries, cracked teeth, and so on, which will take time. Once you have done your various testing, you might have to use special tests with this type of patient. You would then make a definitive diagnosis based on the presenting features. And then you can go on to your management strategy, which we'll come on to. On the other hand, if you have a patient who is known to you and it's recently had, for example, scaling debridement, periodontal non-surgical treatment, then you would know that the discomfort has probably come from the procedures that you use, what we would call post-operative sensitivity. This is probably the same if they've had a bleaching or whitening session, they may come back and complain about sensitivity. So again, you can look at the clinical features, and because you have the history already, it may take you less time to diagnose the problem. So you would use the same diagnostic test, a simple code air blast. Then you would ask the patient to score it on a scale of 0 to 10. and 0 being no pain and 10 being the most uncomfortable pain. And then you could then, if you want, use a varnish or a toothpaste, and after 5 minutes then reapply the test and see if there's a problem. And if they still have sensitivity and the score is pretty much the same, then it's likely that it may not be dentine hypersensitivity. However, if it's been reduced in severity, then it's more likely to be. Now, on to the management strategy. Again, depending on the severity of the problem, will determine whether you will give an immediate treatment, professionally applied, or you would give them a toothpaste. And then you would ask them to come back on another visit, if possible, and see whether the symptoms have been alleviated. What you can do is also give them a pain diary and ask them to comment on whether the discomfort has been reduced during the time after that you've given the treatment. If it's been successfully treated, then you just simply give further recommendations on what type of toothpaste they can use, toothbrush modification, and so on, and then monitor them as and when you think you need to see them based on the toolkits that we can use. If there's still sensitivity, then you would have to go on further with more invasive treatment. So if we go on to the treatment path now, please. So again, this is a model which was developed a number of years ago. It was originally based on the WHO pain model. Robin Orchards and I use this in one of our publications. And really, it's a stepwise approach to treating or managing sensitivity. And it goes, and really it fits in today with a minimally invasive treatment. So first of all, you would screen for dentine hypersensitivity if it's diagnosed. Depending on the how severe it is, you eliminate the etiological or predisposing factors. You may give them a desensitizing toothpaste or mouth rinse, and you would also do various recommendations with oral hygiene management, reduce any potential aggressive or overzealous toothbrushing, particularly with if they're using high levels of acidic drinks. You need to try and separate that to prevent any further tooth wear. So that would be the basic for level, what we call level 1. If, however, after you see them again, the pain persists, you may wish to use topical agents, fluoride varnishes, which we've already alluded to, and or desensitizing toothpaste or mouth rinse. Again, you include the prevention strategies that you've developed, and that would include dietary advice. If, however, the pain persists, you may want to use a more invasive strategy, restorative materials such as glass ionomer cements, composite materials, and you may have patients, those of you who are periodontists, and you may be doing periodontal surgery. You may need to use that to correct gingival recession with or without sensitivity. Now, each of us must assess whether the problem is mild or moderate, generalized sensitivity, or moderate or severe localized sensitivity. The severity of the problem will determine whether the treatment is more invasive, and that's key. So it's not just simply giving the treatment or procedure, it's altering the patient's behavior and modifying what they do within the day-to-day lifestyle. Now, I think finally what we need to address as clinicians, and also for the patient's perspective, if we want to improve the quality of life, we have to acknowledge that we might not get pain down to 0 with our treatment. So we have to manage our expectations as well as the patient's. Now, to my mind, if we can reduce the level of discomfort to a level in which they're able to cope in their day-to-day practices, rinsing, eating, and so on, I think that's still a benefit. So please remember, don't just give a toothpaste or a procedure without giving the additional preventive advice which we've discussed in this session. The other thing I would like to say, I'm not trying to enforce you to spend extra time which you may struggle to fit in your daily practice. What I would like you to do is look at the principles that I've outlined in this session and apply them to your practice. And I hope that will help you monitor the condition, but also alleviate your patients' discomfort in a way that enables them to have a better quality of life. Thank you very much for listening.
Thank you, David. So now I'm going to speak to Rina Wadia, who will give her clinical input on managing dentine hypersensitivity from the standpoint of a perio referral clinic. Rina, what is the prevalence of dentine hypersensitivity in a perio practice?
Well, I think generally, I think there's quite a huge variation in the prevalence of dentine hypersensitivity in the literature, but it is a significant percentage across all age groups. We do know that. In a perio practice, as you would imagine, it's much more, and I would estimate at least 50% of our patients suffer from dentine hypersensitivity, and this might be at presentation due to the actual periodontitis itself, or it can also occur after treatment as well. And I guess an interesting point here is how many patients actually speak up and say they suffer from sensitivity. And often patients just think, they have to live with it. So it's actually, I think at this point to establish, it's really important to ask our patients, do you suffer from sensitivity? So we can actually do everything we can to help them.
And dentine hypersensitivity can be one of the consequences, of course, of perio treatment.
Yeah.
How do you manage this challenge with your team and referring dentists?
Well, I think firstly, managing patient expectations is key. Periodontal treatment is very predictable, but some of the consequences, such as sensitivity and even things like gingival recession, they can be quite alarming to our patients, especially if they're unexpected. So it's super important to ensure patients are firstly made aware of the fact that sensitivity can occur following periodontal treatment. And this should be a key discussion point during our consent process pre-treatment, not after, but pre-treatment. And however, from a dental professional's point of view, I think it's important we try and tackle this from the outset. So we also need to reassure patients that, yes, it might occur, but we're going to do everything we can to minimize it and ideally eliminate any issues. And we take a team approach when managing this. So all the hygienists in the practice are aware of their role. I also liaise with the referring clinicians, so they're aware of their long-term role in managing the condition, because that's really important as well. So it's quite clear, managing sensitivity, it's a joint effort that includes your patient, your in-house team, and then also the referring clinicians as well.
Yeah. Very true. And you speak about working obviously with your whole team in managing dentine hypersensitivity and communicating with the referring dentist.
Yeah.
What advice would you give to other clinicians treating and maintaining perio patients who also suffer from dentine hypersensitivity?
Yeah, I think you've got to look at it like we're working as a team with the patient and the referrer and the clinicians. It's got to be 360. So don't just focus on, I just need to treat the dentine hypersensitivity, focus on one thing, think of it 360. So first, for example, you want to take a thorough history. You need to know what might be exacerbating that dentine hypersensitivity. Is it an erosive diet? Is it, gastric reflux? All those things need to be addressed as well. And that might include medical management as well. You need to try and manage it actively, commencing with actual advice on home care products, as well as in-house agents as well. So I think it's useful to look at 360, but then also a step-by-step approach. And, patient-reported outcomes are just as important as clinical outcomes. So although it's very, in a perio practice, we're so focused on improving probing depth and reducing bleeding, I think things like that matter to patients, like patient-reported outcomes, like dentine hypersensitivity, is just as important in the current day and age.
I couldn't agree more. What is your current treatment protocol in-house for managing dentine hypersensitivity? And how do you manage sensitivity associated with perio treatment?
So I think the first thing is we ensure that home care is optimal, and patients are using a toothpaste that will actually help with sensitivity, and basic advice. We shouldn't underestimate the importance of basic advice, like spitting, not rinsing. We've got to emphasize that and can't assume that all patients know that. So that's the first thing. If sensitivity is due to or is exacerbated by other factors such as an acidic diet or gastric reflux or perhaps parafunction, then this also needs to be addressed. So we often give diet advice. Sometimes we ask our patients to see their GP if they're suffering from things like reflux, or we sometimes ask referring dentists to make a mouth guard if there's any signs of parafunction. So that's the kind of step-by-step approach. When we're doing the treatment, we use the EMS piezo, which allows us to use the warm water, which makes quite a big difference for sensitivity patients, especially if we're doing maintenance or supportive care, where we're not usually providing LA. That warm water makes a big difference. Again, for maintenance, I found that rubbing on prophy paste onto the tooth surface can really help as well. And for treatment, of course, when we're doing root surface debridement or subgingival PMPR, then we do numb up, and currently the practice we're using the wand for local anesthesia. And then at the end of each appointment, regardless of whether it's maintenance, regardless of whether it's treatment, we always apply Biomin paste. And patients we found are quite keen on the melon flavored, which has been quite popular so far. But the reason why this is completed following any type of treatment is the pellicle layer is removed during treatment. So by applying Biomin, we're essentially occluding the tubules post-treatment. And so far, we've had fantastic feedback from all of our patients. If there's an allergy to SLS, then we use a high fluoride foam, sort of foam in some trays, and we use that at the end of the appointment. But some sort of treatment for the sensitivity is really important. And then all of these treatments, like the Biomin, it's applied mid-treatment as well. So we see our patients mid-treatment, and then also at the follow-ups, we apply as needed. And that sort of protocol tends to work really well for us.
And you speak about Biomin F. What advantage do you find from applying the Biomin F for kids after perio treatment? And do you choose Biomin F for kids because of the mild melon flavour rather than the mint of the standard adult Biomin F toothpaste? And do you find that patients find this more acceptable?
Yeah, I mean, I think it significantly helps with sensitivity from what we've found so far. And patients really do feel like you're taking that extra step as well, not just saying if you get sensitivity, use this toothpaste, you're actually in-house taking that extra step, and they notice that as well. We have actually got the melon, we've got the mint one as well. Sometimes we offer patients a choice, but it tends to be more because of the flavor. People quite like the melon. It's quite refreshing, so it seems to be really popular amongst our patient group, at least.
And from your experience as well, what types of perio cases with dentine hypersensitivity involvement are the most challenging?
Most challenging, I guess, treating those groups of patients who already have significant dentine hypersensitivity to start off with, even before you've commenced treatment. They're definitely the most challenging group. That sensitivity is likely to be due to periodontitis and root exposure, and we're seeing severe cases in our clinic. So that with treatment it's going to get worse. So it's really important you ensure you're armed with all the tools you need to ensure you're actually minimizing this, and in fact doing everything you can to help reduce it. So they, I would say, are the most challenging cohort that we have to deal with in terms of dentine hypersensitivity.
And for other clinicians watching, for those particularly challenging patients, they generally can be more phobic, can't they?
Yes, because they've had a bad experience in the past, jumping in the chair and things are hurting or sensitive. So they can be phobic. So I think we have to also think about how to manage anxious patients as well at the same time. And again, a stepwise approach, showing them exactly what you're doing, making them as calm as possible, and making them, showing them that they can trust you as well. So giving them a good experience so that they are wanting to come back. We've had quite a few patients who initially they're too scared to even sit in the chair, and now they literally can't wait to come and see us. So that they're generally the most satisfying group to treat as well, to be honest, because you see that change in them, which is lovely.
Yeah, it's so rewarding cases that inherently, I've had patients in the past myself that have been so hypersensitive and they are so phobic. What would be your top tips for those particular patients?
My kind of top tip is as I mentioned, just always give the patient a good experience. The last thing you want to do is they're in severe pain and they don't come back again. If that means for the first few appointments, whilst you're getting it under control, you have to numb them up. The main thing is that they have to be comfortable in your appointments, and then you can start dealing with the sensitivity and the reasons why they've got sensitivity in different ways. The last thing we want to do is give our patients a horrible experience. They don't come back, their mouth deteriorates, and then they're even more scared of going to the dentist and have an even worse experience. So I think for me, I've always found that the best thing is find out, make sure they're comfortable, and then make sure you find out why they're getting the sensitivity and what you can do to help them, and explain what you're doing. Like, say saying, for example, I'm advising a low acidic diet because I think that will help with your sensitivity. And I find when you're not just focusing on the mouth, like you're not just focusing on the teeth, and you're thinking about things like diet, the patients do quite like it, because you're taking that extra step, because we at the end of the day, we're healthcare professionals, and we need to look at it as a whole, not just focus on that tooth.
Yeah. Just out of interest, Rena, have you ever worked with other physicians outside of dentistry in managing dentine hypersensitivity, such as dietitians?
I haven't yet, but it's definitely something I'm looking at, especially because of the links between nutrition and perio as well. So I think there is a sort of role of nutritionists and dietitians in periodontal or any dental care as such. I have referred quite a few patients to GPs to look at gastric reflux and medications for that, especially if it's uncontrolled. So I have looked at working other professionals in that way, but I think there is a role perhaps for a dietitian or nutrition in this as well.
Yeah. Watch this space.
Watch this space.
Thank you so much, Rena.
You're very welcome.
So now moving on to Siobhan Kelleher, who will be elaborating on managing dentine hypersensitivity through behavioural change methods. So Siobhan, how do you engage the patients in managing their dentine hypersensitivity at home?
Well, Victoria, how do I engage the patient? Well, first of all, we would have a lot of information coming through from our questionnaires that we would have the patient fill out before they even come into the surgery. So we'd have a lot of questions there to ask them about what products they're using. And then going on from that, there in the chair as part of the data collection, as part of doing the consultation, I would tend to work with a coaching approach like motivational interviewing. So, I want to engage with the patient, I want to focus, I want to evoke, get all that information out of the patient, and then make a plan on what's going to work. So if we keep with motivational interviewing and the guiding principles, and if we think of rule, so RULE, so the O first is that resisting, that kind of fighting reflex that we get, say, sometimes with a patient when we start engaging, about their oral hygiene or hypersensitivity. And we kind of wonder, well, why are we getting that kind of resistance? And sometimes it can be that we're acting a little bit as the clinician, a little bit too like the expert, where we have to let the patient be the expert. So it's about co-creating this appointment together. And then if we go to you in the part of rule, it's the understanding the patient. Well, what's going on with the patient? What does the patient want out of this appointment? If they have sensitivity marked on the questionnaire, going down that route, really understanding where the patient is at with it. Then we go to L, which is listen. And when we say listen, it's not just listening to respond, but it's an active listening. So really following the words. When we're, say, talking about the sensitivity, that somebody may say, like, I haven't eaten ice cream for years. So we're kind of saying, okay, ice cream, hasn't eaten for years. And then picking up on those words through the active listening and going after those with inquiry again. Does that make sense?
Yeah.
And then the E is for empowering. So again, going back to that co-creating. What is their knowledge? What do they know about hypersensitivity? I often get the iPad out now, which is great for communicating at the moment because it's quite difficult with all the PPE on. So testing where their knowledge of hypersensitivity is, getting the iPad, showing some, I have some of my favorite little clips, and saying, were you aware of this at all? And we'll sometimes say, oh my goodness, no, do you really think you can actually help me then? We say, yes, of course we can really support you with this. I find with patients that, have sensitivity, they're so grateful for any help that you can offer, because it really impacts on their quality of life from day to day. Just even the drink of cold water, never mind the ice cream or, that lovely sorbet on Valentine's Day. So any little help that we can guide and support our patients with, they are really, really grateful.
Absolutely. And are there any particular tools that you'd hone in on that you'd utilize specifically for this purpose for the listeners?
Well, I would use, so if it's a new patient that comes, to the practice for the first time, we would definitely do a scaling technique. So, where is the pain at right now? With the hypersensitivity between 1 and 10, I always say, above 7 been quite severe. So we'll mark that down. Then we might use the scaling, if it's really severe, well, how is this impacting on your quality of life? So again, between 1 and 10, we'll mark that down. So 7, above 7, again, be very severe. And then we have that recording in our notes. So, there's always follow-up. We can always, if sensitivity is to return again in the future, to go back. What was the treatment plan that maybe worked for this patient? Again, going back to that active listening, what's going on with the patient? Did they just change the toothbrush recently? Oh, I just tried this new whitening toothpaste. My goodness, my mouth's, really not the same in the last couple of weeks. What's going on? And we've been covering the causes of sensitivity in this session. So just really listening to those answers and, how can I help in my role, if you like? And is it that I can help by product recommendation, or who else needs to come in? Who else needs to be called in? Maybe the dentist, maybe the specialist for occlusion.
Can you give some examples now, I guess, again, more specifically, on how you'd use specific behavioural change tools for different scenarios?
The scaling again, so on the scaling for the patient, those scalings can be important just to monitor the patient. Then the action, what do we need to do here for the patient? So is it products? So often we would start with the products, don't we? We send them home with the products. And then I always review. So at the moment, we don't want more footfall into the practice, so we don't have them nipping back in for that 5 minutes. So I will send the patient home with a diet sheet. So just the old-fashioned 2 days in the week, 1 day at the weekend, get them to fill out the form, tell them to send that form back in within a week. So it really holds them accountable to sending that back in. Then around, about 10 days later, I'll give the patient a quick 5-minute ring rather than having them call back in. So, the review is, well, what's going on? Did this product work? Do you need more product? If it did work, great. If it didn't, what else needs to be done? Does the patient need to come back in? So that's kind of maybe the wedding person.
Maybe an adolescent, somebody in their teens.
Yeah, so even sometimes with orthodontic brackets, especially, as the teeth are moving and the bone is moving, the teeth can definitely be very sensitive. So similar again, getting to the bottom of what's going on, giving that good advice, but getting that teenager again to really co-create that appointment with you, co-create that plan. Because if they don't believe it in themselves or think that it's important, and again, going back to sensitivity is one thing I find that patients do want, they will work with you to get rid of it. But often a patient may not be aware that there is ways of getting rid of it and that it's just part of life. So they're so grateful again when you do help them to get out of this sensitivity.
Absolutely. And co-creation, I think, is such an important aspect, isn't it, Siobhan, in incorporating the patient, feeling so included in their plan forward. That they
Absolutely, and that's where the evidence is now. You know, this coaching approach. And we are kind of used to being the experts and having all the answers. But unless we can, you know, like that inquiry, that evoking, getting that information out to the patient and really letting them make the decisions. And I suppose that's probably going to be more the way of the future now. You know, and still always, as we've always known, asking those open-ended questions.
Yeah. Over the years, Siobhan, you've been working within dentistry for many years, and you are a go-to for so many colleagues, and especially in regards to behavioural change and your current studies with your Masters in Coaching. Have you noticed a significant difference in patients' changes due to incorporating more behavioural change models consciously within appointments in comparison to maybe years back when you weren't maybe actively using what you are now?
Absolutely. And previously, I would have thought that because I'm very interested and always have been in soft skills communication. And I thought I was doing a really good job. I thought I was, you know, I would use the intraoral camera. I've always had the iPad. I record oral hygiene instructions on the phone because we know that patients often don't hear or, you know, don't take everything in because they can be quite anxious. But when we start using the coaching approaches and asking those questions and then at the end recapping and saying, so what are you taking away today? Sometimes I'm a bit taken back on what they say back to me. And that was something I never used to do previously. And then you sometimes have to kind of go back again a little bit, you know, and go back to that co-creating the appointment again and rephrasing how you put that that advice across. So, you know, it's something to start trialing and just ask that at the end of the appointment. What 2 messages, what 3 messages are you taking away today?
Yeah. Well, I think that is a very good take home in itself. So thank you so much, Siobhan, for everything you've shared today. Many tips within that on supporting us as clinicians in supporting the patients in the behavioural change specifically related to dentine hypersensitivity. Is there anything else you'd like to add before we end this webinar recording today? Any additional tips for any clinicians out there?
I think really the availability of products at the moment, especially during COVID, people live in isolated areas, perhaps you're recommending products in the local chemist that may not be in stock at the moment. It's one thing we're noticing. So just signposting, where can patients find these products? You know, is it online? Do you have them available in the practice? But it's just one thing to really highlight there at the moment.
Yeah, good point. Good point. Thank you very much, Siobhan.
Thank you so much, Victoria.
So sadly, we've come to the end of the unique format of having a panel on a webinar today. I'm sure you'll all agree the panelists have shared a broad view on the topic of dentine hypersensitivity and key practical tips for working with patients to overcome dentine hypersensitivity. They have given us a great deal to think about. On behalf of Biomin, I'd like to thank each member of the panel for providing their expertise today. So the takeaways for today would be remembering that dentine hypersensitivity is impacting quality of life, and to think about all the elements from the diagnostic test and treatment path, and including what is viable in practice, as David shared, and also including the whole team where relevant in the management of preempting the possibility of dentine hypersensitivity. And lastly, integrating effective behavioural change tools in the management. Biomin certainly has a place specifically to treat dentine hypersensitivity and can be used at home and in practice. Biomin F has received accreditation from the Oral Health Foundation for sensitivity relief and remineralization. It is also CE certified as a medical device for the treatment of dentine hypersensitivity. So please now head over to the Barman virtual stand to join us for a live Q&A and collect your PDF of the diagnostic tool and treatment path for you to use in practice.